lifelong consequences, as most people will be very familiar with. But the number of people suffering from spinal cord injury is perhaps surprising. 15,000 Australians live with spinal cord injury, 80% are male, with an estimated annual cost of 2 billion. So it's not a trivial problem. Christian and my interest in spinal cord injury is really derived around the fact that spinal cord injury causes the greatest severity of bone loss of any pathological condition. So if we think of menopause, rate of bone loss 3 to 5% per year, or glucocorticoids somewhere between 5 and 25% loss per year, spinal cord injury exceeds that with up to 20 to 40% of bone loss in the first year after injury. And there are a number of interesting features of bone loss and spinal cord injury. It's biphasic. There's an acute phase with dramatic decline followed by a chronic steady state phase. It's seen most dramatically around the epiphyses with preferential loss of bone at the knee. And there's also compartment-specific bone loss with predominant loss of trabecular bone and endocortical loss, less periosteal cortical bone loss. And so Christian and I, in partnership with the spinal team at Royal North Shore Hospital and the Royal Rehab team at RIDE, have been looking for strategies to mitigate spinal cord injury bone loss. And globally, at least, there are a number of different strategies that have been looked at. There are rehabilitative strategies such as functional electrical stimulation and standing or loading regimens. And then there's drugs, which is where Christian and I come in. And I'll just briefly discuss the anti-resorptive approaches that we've adopted, but also potentially speak towards the future with osteoanabolic therapies. The existing studies are very small RCTs, there's subject heterogeneity, and the outcomes are also somewhat limited. So North Shore is one of the 2 tertiary centres for spinal cord injury in New South Wales. Our unit would see between 70 and 90 new cases per year. There's a large outpatient service for chronic spinal cord injury patients and strong links to Royal RIDE. And so Christian has pioneered a service called the Healthy Bones Initiative in spinal cord injury, is aiming to achieve delivery to all patients within the acute setting after spinal cord injury, a single dose of zoledronic acid within 6 weeks of their injury, and then prospectively assessing bone loss and bone turnover with biochemical markers, as well as with bone density scans and prospective acquisition of fracture data. In terms of chronic spinal cord injury subjects, we've had invitations by general mailer to have a bone health assessment. This is not our data, it's previously published meta-analysis data, but just to highlight the fact that zoledronic acid is able to somewhat forestall bone loss if given shortly after spinal cord injury. So in the open circles, the reference group, and the dark circles, the actively treated group. So we hope to be able to prevent bone loss and to maintain skeletal structure and strength by preemptive delivery of anti-resorptive agents. The study has a primary outcome, which is the aerial bone density at the knee, with region of interest acquisition on our bone density scanners. And we have a validation study with QTT. In terms of long-term assessment of skeletal health, sorry, I'm being cut in from somebody else. No, thank you. We've got effects of early treatment with zoledronic acid, comparison of the bone density trajectory and fracture with historical controls. But most importantly, I think that's not me singing, I should say.
Swati, I don't know if you're there, but can you
it seems like someone has just overtaken. Yeah, it's just got removed now. I was trying for a very long time to remove them.
No worries, thanks.
Okay, I can sing if you would like me to, but potentially for the sanity of the rest of the attendees. That's perhaps best if I don't. Provides a framework, most importantly, this initiative provides a framework to collaborate with rehab physicians and spinal cord injury support groups to develop clinical guidelines for skeletal issues in spinal cord injury. And we hope, in collaboration with Ego Seaman at the Austin in Melbourne, to be able to conduct the first human clinical trial of romosozumab in spinal cord injury in the not too distant future. What we're really thinking of in the future is, as the Walk Again robotic exoskeletons traverse from being science fiction to science reality, we need to pay attention that these advances in spinal cord injury management are only possible if the skeleton is strong enough to weight bear. And that's clearly not true for a vast majority of chronic SCI patients for whose bones have dissolved. I'd like to acknowledge in particular Christian Gurgis for all of these slides and for his academic leadership in this area. Lynn March, Jean Doyle, our research nurse who's worked tirelessly in this area, Leanne Neer, a spinal cord consultant at Royal North Shore Hospital, James Middleton, Gerard Weber, Roxana Harisanu, and funding from the Musculoskeletal Alliance. Thanks for your attention. And that's me.